The Boulder County coroner says they've seen a decrease in fentanyl deaths. They're now seeing the emergence of these very potent substances called nitazines.
Let me preface this by saying this video is not about fentanyl, but something even stronger, man. Even stronger.
A snapshot of America's fentanyl crisis. An average of one person every 10 hours dies in this city of a fentanyl overdose.
I'm sure you all heard of fentanyl. The very potent opioid, 50 times more potent than heroin and 100 times more potent than morphine, that is wreaking havoc on the streets.
Fentanyl is the main cause of overdose deaths and the #1 killer of adults under 50.
Regular people, square Joes on their way to work, they'll stop, hang out with me, try this drug for the first time, and then leave their life. Literally, from that moment on, they're just out here with us.
Fentanyl is the main contributor to the most recent wave of the opioid epidemic. To quickly recap, the opioid epidemic started in the 1990s when many people were prescribed medications such as OxyContin post-injury or for chronic pain.
And so when the pills became too expensive or the prescription ran out, they turned to other drugs, like heroin. That was the second wave.
Fentanyl is the third wave of this epidemic, after medical prescriptions ran out and other well-known street drugs were tweaked to reduce production cost and simultaneously increase potency. At this point, everyone is aware of how dangerous fentanyl can be. But could there be another wave brewing? Well, today we're going to talk about a drug that has entered the illicit drug trade that is 10 to 50 times stronger than fentanyl itself.
1,000 times more potent than morphine.
The street name is actually Frankenstein, a little easier to pronounce and also explain.
Today, we're going to talk about nitazines. They can be dated back to the 1950s, when Swiss chemists at Ciba, a chemical company, tried to make an alternative to morphine. They found that nitazine does attach to the opioid receptors in the brain and were therefore considering it as a potential pain relief medication.
They figured out that a nitazine does attach to an opioid receptor, but they actually didn't like how potent it was, so no one ever brought it to market.
That's right. It was too strong, bro. So they choose to discontinue it. To this day, it is not legal, not even for medicinal or pharmaceutical purposes. Scientists recognized that the potential for abuse was too high. Frankly, it was just too risky. However, at that point, the formula was already found and the instructions were already made. And in the modern day, with medical literature so readily available and with the general public having access to basically anything online, the nitazine formula has made its way into the hands of drug dealers. This has led to the emergence of nitazines being sold and abused in various parts of the world. That's right, this heavy hitter is now floating in the illicit drug supply.
I mean, we are always behind the 8 ball with what is being created in the illicit drug supply.
In this video, we'll discuss nitazines, what they are, and why they are so dangerous, beyond the obvious. Because I mean, yes, they are so much more potent than other street drugs, and that is problematic in and of itself, but what are the actual implications of that in terms of how nitazine users are treated? Basically, how will doctors respond to a drug that they have no experience with? The most important thing we can do is learn. What do you say, interns? Let's find out some more about nitazines, and you can tell me your thoughts on how to handle it in the comment section. So, even though nitazines were first synthesized in the 1950s, because they are unfamiliar to the majority of the medical community, they are being considered an emerging class of drugs, a new drug. They are classified as a novel psychoactive substance, or NPS, also sometimes referred to as a novel potent opioid, or NPO. This means they are relatively new and typically came about through the modification of existing chemical structures or synthesis of entirely new compounds. It also highlights that as opioids, they exert psychoactive effects on the central nervous system. Opioids include any drug that acts on opioid receptors in the brain, and any natural or synthetic drugs that are derived from or related to the opium poppy. Nitazines, like fentanyl, are synthetic opioids, meaning they can be produced entirely in a laboratory setting without the need for poppy plants or opium. Specifically, nitazines are classified as benzimidazole opioids. As Dr. Alexandra Amaducci, emergency medicine physician, explains,
They have a different chemical structure than opioids we are used to, such as heroin or fentanyl or morphine.
Nitazines contain a benzimidazole ring with an ethylamine in the 1 position and a benzyl group in the 2 position. And let me just say for a moment that although I thought organic chemistry was behind me, I guess it came in handy after all. The synthesis process permits the attachment of various substituents, making mainly similar analogs, or versions, some of which include etonitazine, metonitazine, isotonitazine, and metodesnitazine. They exert their effects by binding to opioid receptors in the brain, as would morphine or heroin. Like all opioids, they have analgesic or pain-relieving properties. Nitazines just happen to be very, did I mention very freaking potent? Now, we have covered opioids in another video, the one I did on fentanyl, which I will link below. But for the sake of this video, I will give a quick refresher on how they interact with the brain and the body. Opioids are agonists, meaning they work by binding to and activating opioid receptors, particularly the mu opioid receptor in the brain, spinal cord, and other parts of the body, which can result in a reduction in the perception of pain. However, opioids can also produce other effects beyond pain relief, including sedation, euphoria, and respiratory depression. These effects are mediated through various pathways in the central nervous system, or the depression of them.
Like heroin and morphine, nitazines attach to receptors in the brain and cause depression of the central nervous system.
The depression of the central nervous system can result in slowed breathing, decreased heart rate, and decreased alertness, among other effects. This is crucial to understanding why opioids, particularly in high doses, and other depressants like alcohol or benzodiazepines are a dangerous combo. Nitazines are like opioids on steroids, and they bind in the same way as other opioids would, except they are, as doctors deem them, not particularly safe for consumption under any circumstances.
Use the opiate the night before and they can't open their eyes still by 11 a.m. the next day. Like it's zombifying.
They are considered a Schedule I substance, according to the DEA, which is the US government's drug enforcement agency. This means 3 things. 1, the substance is considered to have a high potential for abuse. 2, the substance has no currently accepted medicinal use in treatment in the United States. And 3, there is a lack of accepted safety for the use of the drug or other substance under medical supervision. Therefore, yeah, it's a just don't do it drug.
So just don't do it!
However, it has been slowly making its way onto the drug scene.
Just calm down, don't do it!
They were first identified in the unregulated drug supply in Canada in 2019, typically found as white, yellow, or brown powders that can be inhaled, injected, or swallowed. It is often mixed in or marketed as other drugs such as fentanyl, oxycodone, Dilaudid, or benzodiazepines. Nowadays, so many street drugs are contaminated and contain more and more additives. What may seem like a bag of heroin may be a bag of a little bit of everything. As Dr. Jenna Nicolaides, toxicologist and emergency medicine physician, explains.
You test a sample bag of heroin and it has like a little bit of heroin, a little bit of fentanyl, metonitazine, cocaine, a little bit of sedatives, a little bit of crushed pharmaceuticals.
According to DEA reports, nitazines are being sourced from China and mixed with our other drugs. Some drugs sold on the black market are actual medications that were originally intended to be used in a medical setting. However, you can be sure that any product containing nitazines was never made for that purpose. It was both produced and sold on the black market. The unregulated drug supply is increasingly toxic and unpredictable. Many drug dealers are always trying to figure out a way to stretch a supply or make the drug more potent to hook their customers. So it's easy to see why they start experimenting with recipes. A simple extra ingredient added to the mix can be great for business, for the dealers. They get to supply a product that is stronger than any other drug on the block. For the consumers, on the other hand, it can be the difference between their typical drug trip and an overdose.
The fact that metonitazines in the drugs means that they are using very, very contaminated drugs.
With nitazines, because they are not being used medically, meaning any production of them is going to be approached from a business, aka profit maximizing standpoint, not necessarily with the health and well-being of the person in mind. And while obviously drug dealers want to have customers who are alive,
doesn't make financial sense to kill your customer base. Customers start to notice that people are dying. No one's buying that cocaine anymore.
Still, the safety of the product is not of utmost importance. As a British drug dealer describes in this Channel 4 documentary, his job is to serve up them 90s, you feel me?
A nitty is somebody who's a drug addict, someone who don't take care of themselves and just abuse drugs differently. So that's where the money is, you know what I'm saying?
The money is an addiction. I wake up, I think about how much I need to make. I'm motivated to make money.
Most of the use of Nitazines is actually unintentional. Dr. Amaduchi herself performed a study with a few of her peers in the medical community, and it points out, since they, the drug users, are buying drugs from the underground market, they buy drugs assuming that they are what the dealer tells them they are. However, they often are not. The study continues to say some of the people who overdosed on Nitazines reported that they thought they were using heroin or fentanyl.
Can I help you?
Good afternoon. We would like to buy 2 pieces of Molly, please.
And because this drug is so much stronger than other opioids, this can greatly increase the risk of accidental overdose, especially when used in combination with other drugs that suppress breathing and heart rate.
If you mix up the bag or you get the wrong bag and your tolerance isn't that high and you get the Nitazine bag, then maybe you overdose and die.
Overdose occurs when the respiratory system slows to dangerous levels. Like any other drug, Nitazines affect everyone differently based on their size, weight, and health, their tolerance level, whether other drugs are in their system, the dosage, and the strength of the drug. Because most users are unaware they are using Nitazines, they are completely unable to prepare themselves for the potency of such a drug. It may be their first time, and they may overdose, even without being addicted prior to.
It may be one time and you're out.
Any hit could be your last hit. That's freaking wild. Some of the symptoms of an overdose include shallow or slow breathing, bluish or grayish lips and complexion, passing out, coma, and death. The signs of a drug overdose are recognizable, and for the most part, first responders know how to treat them when they occur. Naloxone, or Narcan, is an affordable medication designed to counteract the effects of opioids.
There are 2 different types of naloxone kits. There's an injection as well as a nasal spray.
It usually starts working within a few minutes and lasts from 30 to 90 minutes.
It is usually obtained through a prescription from a healthcare provider, or it may be distributed through community-based harm reduction programs, public health initiatives, or emergency response services. It works by binding to opioid receptors in the brain without activating them and displacing opioids from these receptors, thereby reversing the effects of the opioids. It is an opioid antagonist, meaning it blocks the effects of opioids and can quickly restore normal breathing in individuals experiencing opioid overdose. However, because Nitazines are not made in a lab with medical intent, this class of drugs is generally understudied, meaning the medical community doesn't really know how to deal with them, especially during an overdose. But as healthcare professionals, this is a huge opportunity to learn.
Keep up with our research, make sure that we're finding what's in the current drug supply so that we can educate the public and providers on how to treat these patients.
I agree with researcher Joe Friedman at the University of California School of Medicine, who said clinicians could benefit from learning more about Nitazines and their potential impact on public health. First responders are facing a drug they have no experience with, and treating a Nitazine overdose in the same way you would any other opioid overdose may not work. Sure, Narcan can be effective, but doctors are worried that bystanders and first responders may underestimate the amount of Narcan needed to resuscitate the patient. As Dr. Anthony March, addiction specialist, explains,
whatever you were going to give, 1 or 2 vials, I'd go up to 4.
May require higher doses or repeated doses of naloxone to reverse the opioid toxidrome.
The study I mentioned earlier, conducted by Dr. Amaduchi, is one of the first studies to report on the effectiveness of Narcan in treating Nitazine overdoses. It found that compared with fentanyl overdose, patients with Nitazine overdose received more doses of Narcan in hospital. It also found that with metonitazine overdose, metonitazine being one type of Nitazine, was associated with cardiac arrest and more naloxone doses overall. This means that the typical 1 to 2 doses of Narcan needed for a patient to recover from an overdose may not be enough. This is important for first responders to be aware of, so they aren't too quick to assume a patient is beyond the point of saving when they are unresponsive to a regular dose.
If anything happens where they start waking up or whatever, you're on the right path.
However, while first responders may need more doses of Narcan to reverse an overdose, sometimes even an increase in Narcan doesn't help. As the study also mentions, there is a higher risk of cardiac arrest with Nitazines than with fentanyl. In general, it is considered more deadly than both fentanyl and heroin.
He's not dead, it's a heroin overdose. Let's break out the Narcan.
Another study in the Drug and Alcohol Dependence Journal, performed by Martha M. Vandeput et al., found that N-desethyl isodonitazine, another type of nitazine, causes apnea, where breathing stops, at about 1/3 the dose of fentanyl. It also takes much longer to recover normal breathing afterwards, 208 minutes from nitazine and only 67 minutes from fentanyl. From these findings, we can assume that it may have the potential to be more deadly than other opioids. Yes, this was a study that was performed on rats, but there haven't been many human experiments with this drug for obvious reasons. So at this point, we have to take the info that we get. Another interesting point brought up by the researcher I had mentioned earlier, Joe Friedman, is that it's an understudied class of drugs. And one of the biggest problems we have is that we don't actually systematically track drugs like Nitazines. And yeah, we don't. Because this drug is so unfamiliar to us as a society, our current drug tests don't pick it up. This means it can slip into the illicit drug stream very easily and often go unnoticed. We don't know what it's in, which inherently makes it more dangerous, for all of the reasons I have already mentioned.
As far as the dog's concerned, there's nothing there. 100% undetectable, pure.
Most people don't know they're taking it, and even if they wanted to use precaution, they can't. Fentanyl test strips cannot detect Nitazines.
Simple strip tests are now being used by dealers and users to check for fentanyl.
Fentanyl test strips are small strips of paper that can detect the presence of fentanyl in all different kinds of drugs: cocaine, methamphetamine, heroin, etc. And drug forms: pills, powders, and injectables. So if those don't work, what is the alternative? How can someone, if they wanted to, make sure their drug is safe? These services are often provided by trained professionals, volunteers, or organizations specializing in harm reduction.
Being open and honest, and then being able to have conversations about the activities that people are having, and seeing if we can get them to be healthier and safer.
However, the sensitive equipment required for drug checking Nitazines in particular is not always available at these locations. So if you can't do it yourself, and you can't go to a local spot, at this point, how many drug users, even the most careful ones, are going to go out of their way beyond those steps to ensure their safety? Probably not very many.
I'm already past the point of like, I've made the decision, I'm using it now, like, come on, let's go. Next thing I know, we're in a broom cupboard in the bottom of Chinatown.
Even getting an accurate picture of how much damage Nitazines is causing is difficult. Their relationship to health risks and overdose deaths is difficult to monitor because Nitazines are not usually tested for in post-mortem examinations. It's also not typically tested for in urine toxicology. So you could hypothetically pass a pee test on Nitazines.
People will come in and try to cheat their test. So if it is not within that temperature of 90 to 100, it is fake. No ifs, ands, or buts about it. There is no way that it could have come out of your body.
All this to say, people using Nitazines to get high is so unexpected that health professionals don't even regularly test for them. It's like, people are using what? Or in this case, it's more like, people have what in their system? Because remember, most people don't even know they're using it.
I've been drugged. Yeah, a little bit. I've been drugged by you.
Regardless, by not considering the possibility of Nitazines being in other street drugs, the medical community is kind of late to the party.
How do you do, fellow kids?
What?
This is why it is so problematic, because it is relatively untamed. In terms of the health professionals, they aren't sure how to handle it, and it is extremely potent. In terms of the drug users, most aren't even aware they are taking it, have little to no way of finding out, and oh yeah, did I mention already? It's extremely potent.
It's genetically engineered by the US government. It's extremely potent, but a completely mellow high.
Is that what we smoked last night?
Like any drug, it can be addictive, and though the long-term effects aren't well studied, a few of them are obviously addiction, dependence and tolerance, health issues like respiratory problems, heart issues, mental health issues like depression, anxiety, and impaired thinking, and social and economic problems like strained relationships, job loss, financial struggles, and illegal activity involvement. However, you should remember that nitazene use really doesn't seem like a long-term kind of thing, given its potency and how unregulated it is. And like anything that is addictive, it can cause withdrawal when you try to quit. Nitazene withdrawal is comparable to a severe opioid withdrawal. One may experience things like excessive sweating, restless legs, fever, dizziness, flu-like symptoms, blackouts, anxiety, and panic attacks. As I mentioned in some of my other drug videos, withdrawal is obviously an uncomfortable process, and for that reason, people may continue to use whatever their choice of drug is to avoid feeling sick.
I would have done anything to make it stop. So I took more oxys, and it did.
Therefore, you can see how the cycle of addiction is so tough to break.
Every time I do dope, I know I'm taking a risk. I know that I might die, but it doesn't matter how many times I've OD'd, I still use the next day because the withdrawals are so bad.
And obviously, we need to remember what drives addiction and the science, the chemistry behind craving, which we actually touched on in our vaping video, which I will link for you guys down below. It essentially lowers our baseline levels for those chemicals, and therefore we feel worse, aka below zero, when we don't take it. This understanding helps make sense of our cravings and may help someone experiencing withdrawal symptoms put their seemingly overwhelming feelings of discomfort into perspective.
If you get all those cues, then don't get the drug. You would experience a crash. There's no high to counteract that slowing down that your brain has initiated.
With any drug, the cycle of addiction can be damaging to a person's life. And with a drug like nitazene, which is so beyond in terms of potency, any drug we have on the market or that we use for medicinal purposes, the risk is just that much more emphasized. The effects are much stronger and it can negatively impact your life much quicker. Nurse Daryl Hams, who works closely with the drug community as a first responder, states that street drugs have been getting increasingly more dangerous.
Russian roulette, like super dangerous. Like it's a whole different landscape. I've been doing this in multiple countries for 30 years.
Now, as a medical professional who has operated on countless people, I've seen my fair share of potent pain-relieving drugs. Scientists saw this drug and said, let's not. I'm not at all advocating drug use, but whereas some drugs are like proceed with caution, this drug isn't even like stop. It's like, what the fuck are you doing, bro? Nurse Hams tells them.
It's not the same as it used to be. It's life and death. And I don't want to sound like an old dude, but it's like, don't do it, you know? It's just too dangerous.
And add to that, people don't know they're taking it. It could easily be slipped into the next batch of the usual product they'd buy from their usual supplier.
You can imagine if someone actually did a line of cocaine, which might be like 10 milligrams, they'd be dead before they got to the other end of the line.
It's being produced strictly illegally on the black market. As it stands, there's no way of regulating it, making it more unpredictable than any of the other street drugs out there, which are already unpredictable enough when used outside of a medical setting. Therefore, hopefully, as more people become aware that this drug that is emerging in the illicit drug trade, people may become more cautious next time someone offers them a random drug at a party. Because in theory, this drug could be mixed with anything.
Those most at risk are recreational drug users who are experimenting with cocaine at a party or taking Adderall from a friend.
His friend said, hey, try this. I heard this is really good. I took it last night. You'll like it. One and done.
No, there aren't very many cases of it so far, but because it is so elusive, it's got public health on its toes. Nitazenes are definitely on our radar, so stay vigilant and stay safe, interns, especially those of you intern age. Take care of yourselves and be mindful about what you put in your body. If you enjoyed the video, be sure to subscribe and give it a big thumbs up to feed the algorithm. And if you are already subscribed, make sure that YouTube didn't unsubscribe you from the channel because, YouTube does that kind of thing. We are well on our way to 600K subs, so we don't want to lose any of you interns along the way. If you didn't like the video, be sure to let me know why in the comment section down below. I'm not sure why you wouldn't, but then hey, I'm not you. I read as many comments as I can, and we use your feedback to make our videos better for you. Lastly, don't forget to follow my gym, Human 2.0 Fitness, for free, right here on YouTube, where we post content that helps you move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one. And just as an aside, this is a pet peeve of mine. Stop calling it fentanyl. It's fentanyl. N-Y-L. Fentanyl.